What is value-based healthcare? Think about all the measurements taken at work, like your HCAP score, that stands for Hospital Consumer Assessment of Healthcare Providers and Systems Survey. It is measuring the quality of patients' experience by using a survey that asks about communication with doctors and nurses, pain management, cleanliness of the hospital environment, and overall satisfaction. That is just one example. Others might include how many hospital-acquired infections such as CAUTIs the hospital has compared to the national and surrounding hospitals' average. The higher the HCAP scores, or the better measures of quality, the higher reimbursement rates from government payers like Medicare, Medicaid, and private payers, which leads to increased revenue for healthcare organizations. The global healthcare system is shifting from fee-for-service to value-based care because it is giving healthcare providers like yourself incentive to provide quality care. Whereas fee-for-service is quantity over quality, the more services provided by the provider, the more money they make. So far, it sounds like value-based care is great for improving patient outcomes and the experience of healthcare. It also encourages collaboration and shared risk among healthcare providers, which leads to better coordination. However, no system is perfect, and even value-based care comes with its challenges. My name is Catherine. I am a nurse like the rest of you, so this matter affects me as it does for everyone listening to this video. The reason why I am presenting this video to you all today is to discuss what the challenges are for value-based care and how nurses, especially advanced care practice nurses, APRNs, play a role in these challenges. The Centers for Medicare and Medicaid Services has set a goal for 100% of Medicare beneficiaries to be tied to quality of value by 2030. However, as of 2020, 40% of Medicare payments are still tied to fee-for-service. In order to reach that goal, we will have to understand what the challenges or barriers are to value-based care. I will be discussing with you the 5 highest ranked challenges according to a survey polling 1,090 healthcare leaders. Lack of resources was ranked the #1 challenge for implementing value-based care. More than a quarter of respondents reported that staffing shortages, insufficient healthcare software, and other deficits made it hard to implement value-based care. Many practices can't afford to hire additional staff that is needed to monitor the metrics and results needed for value-based care. Staffing shortages affect the quality of care and therefore would lower quality measures, resulting in less funding for that healthcare organization, and less funding means less money to hire staff. You can probably see the vicious cycle that value-based care can lead to. How many times has your manager asked you to update the whiteboards while one or more of your patients is in critical condition? If you think about why the managers are so persistent about you updating those whiteboards, the answer is that they want to improve communication between the healthcare team and the patients and their families in anticipation that it will increase patient satisfaction and boost HCAP scores. However, what they fail to realize is that the patient acuity and volume is too high for any nurse to care about the whiteboards unless there is adequate staffing. So, can you as nurses and APRNs play a part in this challenge? Remember how I mentioned there's a vicious cycle in value-based care where short staffing leads to poor quality of care and less funding? To stop that cycle, APRNs can use advanced knowledge and leadership skills to create quality improvement projects that will improve the quality of care and patient satisfaction, thus increasing financial reimbursement in the value-based care system. There are 4 steps to demonstrating your value as APRNs. First, understand what the national standards are, then evaluate your organization's performance compared to the standard. Identify where the opportunities are, and then implement projects or participate in projects that can improve quality of patient care. Other lack of resources reported include insufficient healthcare IT software. Healthcare software is needed to collect pertinent data that helps providers coordinate care so that patients can have better outcomes. This leads me to the second highest ranked challenge: technology interoperability challenges. Technology interoperability accounts for 19.7% of participants who reported challenges in value-based care. If you have used any electronic health record system like Epic or Cerner, you probably know that you can't exchange patient information if the patient was at a facility that used any other EHR system. One analogy of this is you have an iPhone and you switch to a new iPhone. You will still have all your photos and contacts saved through iCloud. But if you switch from an iPhone to a Google Pixel, you no longer have your data since Google Pixel uses Google Cloud Storage instead. Then you will have to manually input all your contacts into your new Google Pixel phone. The same occurs when a physician from one hospital has to request patient information from another hospital and input all the labs, imaging results, past medical history, and other pertinent data into the EHR manually. EHR interoperability closes the gap in care and allows for better workflow. It reduces uncertainty on patient information and benefits all stakeholders in patient care. Value-based care aligns with everything APRN stand for: safe, quality, and cost-effective care. As there's increase in nurse practitioner-owned practices, NPs have to gain recognition that their practices are operational and productive, all while being less costly than physician-owned practices. That means that technology interoperability is a must. APRNs are already under much scrutiny because the American Medical Association, made up of physicians, oppose increased practice authority for APRNs, using the argument that they are not equal in their training and education. A patient who switches from a physician to an NP or for provider care services should receive the same or better care. However, if the NP-owned practice does not have pertinent data from their previous primary healthcare provider, there's a gap in care and the blame will fall on the NP. Monica O'Reilly Jacob is an assistant professor at Boston College Cornell School of Nursing. She says, "We conducted a survey and found only a quarter of nurse practitioner practices participate in value-based payment contracts. Many are ineligible due to insufficient patient volume or other payer rules. However, these practices often intentionally stay small so that they can form better patient-provider relationships. This project aims to find a path for these critically needed NP practices to flourish within a changing healthcare payment landscape." Financial risk and unpredictable revenue streams. The transition from fee-for-service to value-based care is a financial risk because providers need to rely on collaboration among other providers and overall healthcare team to achieve high patient satisfaction scores that will bring in revenue. For an example, even if the nursing staff was attentive and responsive, but the doctor rarely comes to explain the plan of care to the patient, the hospital would be at risk for poor patient satisfaction and lower revenue. Value-based care requires additional staff to monitor the metrics and come up with quality improvement projects that are cost-effective. The cost of hiring additional staff and technology used to implement value-based care can be a financial burden to some institutions. The benefit of value-based care are not seen until money and work is put into building it. Some institutions cannot be sustained financially before they even see any benefits. According to the survey, 17% of those surveyed reported that fear of financial instability and revenue and reliability is a barrier for switching to value-based care model. Switching to value-based care system has its hidden costs too. Imagine you have created a plan for switching to value-based care. The entire healthcare staff is on board with this change and you already hired staff members to monitor their metrics. But what if staff members quit because of the pressure they feel from meeting high standards of value-based care? Now the institution has to hire new staff and spend more money on training. Or what if a patient is unwilling to use the services needed to achieve good results on the quality measure? We've probably all encountered that one non-compliant patient, like someone with congestive heart failure and kidney disease, that keeps eating salty foods and drinking tons of water despite all the education and Lasix we give. They just end up right back in the emergency room with the same admitting diagnosis they had a month ago. APRNs are extremely valuable in reducing the financial risk of value-based care because they routinely evaluate the cost and economic impact of a plan of care while ensuring that it aligns with the effectiveness and expected outcome. One example of this is NP-driven heart failure service focused on post-hospital care, medication titration, and symptom management. Nurse practitioners had more frequent interactions with the patients, which increased their engagement in self-care and reduced the total cost of care per patient by $123, and cost per visit was reduced by $164. Difficulty navigating shifting policies and regulation. According to 16.2% of survey respondents, continuously changing policies and regulations is a major barrier for switching to value-based care. The Centers for Medicare and Medicaid is constantly developing and testing new policies, which makes it difficult for facilities to keep up with. There are various value-based programs within CMS, such as Medicare's merit-based incentive payment systems, hospital-acquired condition reduction program, or hospital readmission reduction program, and so on. While applying for as many of these programs as possible can reduce costs and improve quality of care, staying on top of all the requirements for each program can be exhausting and labor-intensive, especially in the beginning of the switch from fee-for-service to quality-based care. Difficulty collecting and reporting patient information. According to 14.8% of the respondents, the fifth highest ranked challenge of value-based care is difficulty collecting and reporting patient information. This is often tied to the issue of technology interoperability that we spoke about earlier. When there are multiple providers using different EHR platforms, collecting and analyzing and sharing patient data becomes difficult. Since value-based care is centered around coordination of care, lack of access to patient information can prevent effective and efficient care. I've had a patient refuse to get imaging done because they had just gotten it done at another hospital a month ago. These images were critical to diagnosis and treatment plan for the patient, and accessing the test results from another hospital would take time and coordination, resulting in time wasted and perhaps might have even led to poorer patient outcomes and satisfaction. Value-based care is the future of healthcare. This is an important topic because as nurses and healthcare providers, we are responsible for contributing to high quality and cost-effective healthcare. The shift to value-based care does exactly that. Even as consumers in healthcare, value-based care makes sense. In fee-for-service, the list of services provided to us can add up depending on whatever the physician deems necessary, while value-based care gives providers incentive to deliver high-quality care since their pay is based on quality metrics. Although we are making progress in terms of increasing provider participation, there are still several challenges in implementing value-based care. If we don't provide providers with the tools and guidance needed to switch from fee-for-service to value-based care, then we might not be successful. Providers have to take on the financial risk of switching to value-based care. Electronic record developers need to integrate interoperability, and healthcare institutions need to provide adequate resources in order for value-based care to be successful. In this video, I covered what are the challenges. The solutions are much more complicated since it requires trial and error. However, what I hope is gained from this conversation is that you understand what the challenges are and how we can collectively be a part of overcoming the challenges of value-based care. here are my references, and I hope you enjoyed this video. Thank you so much.